Hello, I'm Kay, and I'm a volunteer at the Royal Osteoporosis Society. And we put together this series of videos to help you better understand your diagnosis of osteoporosis. In this short video, we'll aim to answer the following questions. How do I know if I've got osteoporosis? How is osteoporosis diagnosed? And what does the DEXA scan involve? What do the results of my scan mean? And why doesn't everyone over the age of 60 have a scan? Also, how do I know what my risk of breaking a bone is?
Osteoporosis is a condition where bones lose their strength and they're more likely to break. Broken bones and fractures are the same thing. Often the first sign of osteoporosis is if you break a bone easily, but not all broken bones are caused by osteoporosis. So your first question is probably, how do I know if I've got osteoporosis?
Osteoporosis is actually known as a silent disease because osteoporosis in itself doesn't cause any symptoms such as pain or stiffness or immobility. And usually it will be when a fracture occurs as a result of a minor slip, trip or fall, which is the first sign that your bones perhaps aren't as strong as they used to be. Osteoporosis is usually diagnosed on the basis of a bone density scan, which is a special type of X-ray. These scans use dual energy X-ray absorptiometry, usually known as DEXA scans, which measure the amount of bone mineral density at your spine and hip. And that predicts whether you have osteoporosis or whether your bones are in fact normal. The lower your bone mineral density, or BMD, the greater your risk of sustaining a fracture.
I was quite anxious when I went for a DEXA scan because I'm not someone who's had a lot of experience of having anything in a hospital, but it was actually really easy.
A bone density scan or a DEXA scan usually takes about 20 minutes and it's an open scanner, so there's no tunnels to go through. There are no injections or medicines to take beforehand. It is an X-ray, but the dose of X-ray is very similar to that which we would encounter in a normal day with background radiation.
What will my scan results tell you about my bones?
Well, it can actually calculate how dense your bones are, and it does this in two sites, your lower back and also in one of your hips. We can then use this information to compare the bone density that it measures with the bone density we estimate that you would have had when you were at your peak bone mass. The further you are away from this average bone density gives us an indication of your bone strength. Doctors use this risk factor with all your other risk factors, age, whether you're a man or a woman, to help understand your risk of having a broken bone in the future. You may have heard terms such as T-score or Z-score, which we use to help classify people into different risk groups. You may have been told you have osteopenia and wonder what this means. Osteopenia is not a medical condition. It means that your bone density is lower than the average adult, but not low enough to be diagnosed as osteoporosis. This result is common in most older people. It is not a concern unless you have other important risk factors, such as having a spinal fracture or taking a high dose of steroids. If you do have these as well, you may be prescribed a drug treatment to help to strengthen your bones. The bone density is only one part of your assessment towards how strong your bones are. And sometimes people are treated with bone density that is higher. And the reason for this is that doctors take a holistic view of your risk of fracture. When they do this, you might find that when they use other risk factors combined with your bone density, this indicates a higher risk of fracture and a need for treatment, even though the bone density result on its own wasn't that low.
Will I be given my bone scan results and T-score?
You will normally be given your scan results once they've been analysed, and usually by the person who ordered the scan in the first place. On its own, a DEXA scan is not able to identify exactly everyone who's at risk of breaking a bone, so it can't be used as a screening tool. It only measures bone quantity and not bone quality, so it can't tell us exactly who will benefit from having a drug treatment for osteoporosis. This explains why two people with the same T-score will have a completely different risk of breaking a bone.
Will my scan results help you to predict my risk of breaking a bone in the future? Or is there some other way you can predict this?
We now have learnt a lot more about fractures and osteoporosis as time has gone on. And we have online tools that can predict your risk of a fracture without even needing a scan. And the one we use is called the FRAX score, F-R-A-X, which will have simple information about your height, your weight, your lifestyle factors, and any medicines or medical conditions you may have. And this will then give you your score of having another fracture in the next 10 years. So for some people, a DEXA scan is an important part of their journey to getting a diagnosis of osteoporosis. But it's also important to remember there are some people who maybe have already had a major fracture, where because of their age and the type of fracture they've had, we know they've got osteoporosis already, and they just need to go straight away onto treatment.
So if I've already had a fracture, does that increase my risk further?
If you've had a fracture after a fall and you're aged over 50, you have put yourself into the category of people who definitely need assessment and maybe who just need to get straight away onto anti-osteoporosis treatment. The reason is we know that once you've had one fracture, your risk of another fracture in the next 2 years is actually pretty high. But the good news is that we now have extremely effective treatments that can be tailored individually depending on your preferences as well as your other illnesses.
Please remember that we're here from Mondays through to Fridays if you have any questions or issues that you'd like to discuss with us as a result of watching this video. Calls to our helpline are free and are confidential, and no question is too small. You can also visit our website to find out more about the subjects we've covered, plus a lot more besides. We have a network of support groups across the UK, led by volunteers for the benefit of people living with osteoporosis and broken bones. To find out more, please visit the support group pages of our website. Please do get in touch. We'd love to hear from you.